Hello everyone, we are Team 26 and we will start our case presentation by emphasizing the significance of interprofessional collaboration. Why do we even seek it? Interprofessional collaboration involves multiple health workers with different backgrounds working together to provide the highest quality of care. It provides patient-centered care from different perspectives, guarantees patient satisfaction, and delivers more comprehensive primary health care. Consequently, we will have more productive and healthier communities. Our patient Sierra is an 18-year-old trans woman from a low-income family and divorced parents. She presented with numerous medical and psychosocial challenges within her home and community that we summarized in this slide. We will now provide an analysis of Sierra's previous and suggested care in the context of interprofessional collaboration.
I will now speak about the strengths, weaknesses, and determinants of interprofessional collaboration. Strengths include increased patient satisfaction and patient safety, improved quality of care and better health outcomes, and enhanced decision-making and increased innovation. In regard to weaknesses, ill-defined roles may perpetuate misconceptions, leading to inappropriate or no referrals. Additionally, logistical barriers may hinder the development of trust. In our case, miscommunication and lack of rapport prevented Sierra from receiving patient-centered care by her previous providers. Structural determinants include physical spaces, temporal arrangements, and defined communication tools. We must designate areas and times to host face-to-face interdisciplinary rounds and have a standardized system of case reporting with avoidance of jargon and abbreviations. Psychological determinants involve creating an environment of transparency and respect through setting predetermined durations for each member to share management considerations. Additionally, effective conflict management along with verbal affirmations and use of inclusive language will foster team identity and boost morale. To facilitate patient-centered care, we will encourage Sierra's advocacy of her concerns during interdisciplinary rounds and evaluate the quality of her care through patient satisfaction surveys. We will allot time for patient education and make health empowerment resources accessible through a patient portal on our electronic health record system. Our healthcare team consists mainly of a family practitioner who will provide ongoing primary health care in the form of anticipatory guidance, health surveillance, and appropriate specialist referral. Another primary care provider, the naturopathic doctor, will provide naturopathic risk pain management and lifestyle modification recommendations to optimize physical and mental well-being. A clinical pharmacist will appropriately adjust dosages to minimize adverse effects and to ensure patient safety. They'll also ensure medication adherence through patient education. A physiotherapist will complement our naturopathic doctor's treatments with therapeutic exercises to improve grip strength and improve range of motion. An occupational therapist will help to improve Sierra's functionality through various environmental adaptations. A speech-language pathologist and our naturopathic doctor will collaborate to formulate an individualized nutritional plan that addresses her nutritional requirements and dysphagia. A pulmonologist will monitor Sierra's level of asthma control and step up therapy when necessary, while a respiratory nurse specialist will educate Sierra about home-based asthma management. A psychologist will offer psychotherapeutic approaches as an adjunct to medical treatment provided by the psychiatrist, who will manage any mental health disorders should they arise. A social worker will assess home safety and will assist the team in understanding the social factors that influence follow-up care.
Our team aims to provide holistic and individualized care for Sierra. The naturopathic doctor will help relieve Sierra's wrist strain through manual therapies and recommend avoiding aggravating movements, therapeutic exercises, contrast hydrotherapy, and protection against further strain with KTT. Analgesics can be prescribed by her family doctor if necessary. Radiology referral is needed, along with occupational therapy. A naturopathic doctor will assist Sierra in improving her physical and mental well-being with lifestyle counseling, decreasing inflammation in the body with an anti-inflammatory diet, adequate water intake, and fish oil supplementation with improved mood, wrist pain, and asthma management. Stress management strategies such as meditation, diaphragmatic breathing exercises, physical exercise, ecotherapy, built-in social support, and L-theanine supplementation will improve dysphagia, appetite, and overall well-being. Sleep optimization can be achieved with sleep hygiene counseling and appropriate asthma management. Sierra's high susceptibility for mental health disorders warrants regular mental health and suicide risk assessment during primary care visits and referral to psychiatrists or psychologists if needed. Sierra's mild persistent asthma management includes therapeutic education by her family doctor or pharmacist to highlight the importance of treatment adherence and proper inhaler technique. Regular follow-ups, avoidance of environmental triggers, and peak flow meter use will be recommended by her family doctor. For transgender hormonal therapy, Sierra requires regular follow-up with her family doctor to screen for side effects. A referral to an endocrinologist may be indicated. A plastic surgeon could provide anticipatory guidance regarding gender affirmation surgery.
Trans women may attempt to reduce identity threat by carrying out risk-taking behaviors to gain affirmation when experiencing stigma and psychological distress. Trans youth commonly have adverse healthcare experiences leading to care avoidance. Mistrust of the healthcare professionals in the African American community has been fortified by unethical acts towards minorities. This barrier can be combated by ensuring her comfort and autonomy during care visits. Trustworthy patient-practitioner relationships and use of the inclusive language will safeguard her from care avoidance. Sierra's insurance does not include gender affirmation care. Therefore, seeking grants from LGBTQ2S organizations can relieve this financial burden. Sierra is exposed to transphobia and violence in her community. Her social worker must revise her custody arrangements to allow primary residence with her supportive father. By participating in peer support and youth development organizations, Sierra can build resilience, self-esteem, and a larger support network. School-based gender and sexuality alliances lower bullying, and trans students attain more positive health and psychosocial outcomes. Sierra's mother dismissed claims of abuse by Tom, and family-oriented therapy is recommended to address these fractured family dynamics. Her prognosis depends on preventing gender dysphoria. Those supporting transgender youth must be vigilant for signs of risky behavior and provide early interventions to guide her towards the aforementioned resources so she can gain positive affirmation. Thank you.
Thank you very much, team, for respecting the time and for the great presentation. And now we would like to open the floor for the judges so that we can have the questions and answers session. So the floor is open for questions. Who wants to go first?
Thank you so much, team. I really enjoyed that presentation. I just would like to go back one slide. If you can. Yes, this was really excellent. So if you can maybe go, I'd like to give the opportunity to continue with it and speak to exactly how you're going to make the interprofessional team work achieve all of these outcomes. Thank you.
So in terms of exposure to abuse, as we've seen in the case, Sierra was apprehensive about trusting healthcare professionals, but I think we developed good rapport and she was able to share her experiences with abuse by Tom with us. So in this case, as we had stated in terms of the roles within our interdisciplinary team, our social worker would work alongside with whomever represents Sierra in terms of legal custody arrangements, so that she will be removed from having to spend part of her time within that abusive environment, which is her mother's residence. In regard to access to care, Sierra does have insurance, as she falls under her parents' health insurance currently, but it doesn't cover her gender affirmation care. So in terms of her social worker working alongside her to seek out organizations that may provide funding for such care, that would ensure that she does get continued access to the gender affirmative care that she wishes to seek for her male to female transition. In regard to bullying reduction, we have seen that being included in peer support groups, as well as having sexuality and gender alliance clubs within the school systems, they promote better outcomes for their transgender students. So hopefully her school would have such alliances, but if not, there are social support groups and other youth development organizations that can help support her and build up her self-esteem, as well as help her develop her career path, as she stated that she wanted to become a youth social media influencer for makeup. Family-oriented therapy will also aid in the fractured dynamics and help fortify her support system.
Thank you.
No problem.
Thank you very much for this very nice presentation, well articulated. If you go back to the slide before, and the one before, the one that has all the healthcare professionals. So you've done really well in trying to identify all the different healthcare professionals that will be involved on the care of Sierra. And early on, you've talked about the definition for interprofessional collaboration. And you've talked about the roles of responsibility for each healthcare professional. What do you think the barriers are for interprofessional collaboration within this case?
Okay, well, some of the barriers include, well, they can be logistical barriers. So with so many health professionals, there may be varying team schedules, especially with the medical professionals. They operate on a rotation system. So sometimes when they are due to be on service or when they're required, they may not be on service. So that may pose a problem if Sierra needs care by a particular professional at a particular point in time. Also, there are a vast number of specialties within this team, and the department, there may be departmental separation. So teams may not be in the same building. They may be a 5-minute drive down the road. So in terms of coordinating when rounds can be held, it may pose a challenge, and they may be conflicting schedules. So that's something that would definitely have to be worked through.
Thank you.
Another barrier could be just considering other healthcare professionals not necessary, or considering their opinion less important than ours. I think respecting everyone's opinion and giving everyone the chance to have Sierra's case is necessary.
Well done, team. I think this was a stellar presentation. This was brilliant. And I wanted to also highlight that I like how you've managed to integrate the community where Sierra is coming from into the integrated plan for her care. This is well done. I just wanted to find out before I ask a question, just quickly, where are you guys from, and what are you studying?
So I study naturopathic medicine in Toronto, but I'm originally from Morocco.
Okay.
I'm Chelsea Bannister. I'm currently residing in Barbados, but I'm a dual citizen of both Barbados and Bermuda, and I'm studying medicine.
I'm Shalisa Galloway. I'm originally from Antigua, and I went to medical school partly in Barbados, but then I moved to Jamaica last year to continue my medical studies.
I am Mustafa Abu Dahab. I am from Egypt, and I study pharmacy.
Okay, brilliant. So just one question from me is that you've highlighted several challenges. This is latching on from Dr. Ala's question about how the team could actually work in getting to where we want to, or positive outcomes for Sierra. What do you then recommend would be the best strategies to enhance the functioning of this particular team?
Okay, so one of the things that we can do, that we suggested, would be to have a set time. So considering everyone's schedule and time availability, we would post specific times for interdisciplinary rounds. And it has to be a time that is suitable for everyone so that no one is excluded. We would also have an electronic health record system so that there can be ease of transfer of information between professionals. Sometimes with physical files, things get lost or there's a delay in mailing appropriate information, and we want to ensure that the care that we deliver is done so in a timely manner. So the use of the electronic health record system will facilitate that. Also, in terms of our other team dynamics, ensuring that everyone has a chance to speak. Sometimes in every group setting, there's always a person that is more dominant than someone else, and we in no way want anyone to feel like their opinion is not valued or appreciated. So that's why we would set specific times for everyone to speak and share their concerns and contribute to the discussion around our patients.